Well, hi, I'm Allison, pediatric nurse practitioner student. And who is this?
What's your name?
What's your name?
Sophie.
Sophie. And how old are you, Sophie? 3? No way. That's so old. Okay. And you're Kelly, right?
Yes.
Okay. And why are you guys here today? What brought you in?
We're just here for a wellness visit.
Okay. And when was your last wellness visit?
When she turned 2.
Okay, perfect. So our yearly visit. And so I just have lots of questions for you just to go over. We're just going to spend all our time talking about Sophie. Does that sound good?
Yeah.
Okay, yeah, I think so. Okay.
That
Was okay, to start off, just general, any concerns for the visit? Any chief complaints for her?
Well, she still has to use a nebulizer a lot in the spring.
Okay.
And she did have what I would consider to be I'm sorry. She had one instance where she was sick this spring that she couldn't stop coughing.
Okay.
And she was scared of the nebulizer, and so we were having a really hard time getting her to use it. But it got to the point where it almost seemed like she wasn't able to get enough air.
To get it? Okay.
And once she did the breathing treatment, which involved like pinning her down and stuff, she was okay. Like she got much better and was able
So
to
that
sleep.
it was
I got
helping.
it in
It was
my
just
mouth.
albuterol?
Mhm.
I got it in my mouth.
That's really great coughing, so you don't get germs everywhere,
That
huh?
was so good. Thank you.
Do you sometimes get coughs in the springtime?
Sometimes you cough a lot.
Yeah.
Does that make your throat hurt?
But other
But
than
you
that,
cover your mouth.
We'll cover up
Or
my
you
face.
cover it.
Yeah.
That's the best way. Good job. Okay.
And just seasonal allergies.
I don't
other
have
than
that.
nothing
Does she
really.
take anything for the seasonal?
I don't have one
we
of those.
use
You can wear mine,
Bronfed.
okay?
We use Bronfed and Zyrtec. And the Bronfed helps a lot with the cough.
I'm 3.
You're
3, that's right.
So
You
big.
sure are.
You're
Perfect.
so
Okay.
big.
I am so big. Ouch. please
Is
don't
she
do that.
taking the Zyrtec now, or is that
No.
kind of resolved? It's just seasonal.
Yeah.
Okay.
Or if it gets really windy.
Coughs have germs.
Coughs do have germs.
And
And
for the albuterol, or for the nebulizer, we're
germs?
using the blow-by or the mask? Were you able to get the mask? What did they give you?
Usually we put the mask on her.
Try to get the mask
Yeah.
on.
She's no
I
longer
love
scared
the
of it, so
I'm not scared of it.
I
I
love it.
last time she said, now I'm ready to use my other mask. So we're like, no.
Oh,
to
big
wait.
girl mask. That is good.
Mom,
Okay,
I-
so let's just start from the beginning since it's our first time meeting and talk a little bit about your pregnancy with her.
I
Okay,
need
sure.
to.
What week? Oh, how many
know.
weeks?
Ow, I want
39 weeks
to.
and 2
Do
days.
it.
Good. And how much did she weigh at birth?
6 pounds, 2 ounces.
Are you?
Wait, please put that down. We're talking to the doctor.
And was it a normal vaginal delivery?
Yes.
Spontaneous?
Mhm.
You need some doctor stuff?
Yes.
Yes, I'm wearing some doctor stuff. And let's see, did you have any sedation or anesthesia?
You
I
have
did
a
have
doctor
Demerol.
stuff.
Pretty sure she has a stethoscope somewhere.
I do in my bag. Do you want to see it?
Yeah.
Oh, and you can wear it.
You want to wear it?
Yeah.
Oh, perfect. Good.
Mom has a purple.
Yeah, Mom does have a purple one. I've seen that one. That's awesome. Spontaneous respirations at birth? Cry?
Yeah. She was fine.
Great. No resuscitation required? Great. And do you know her accuracy was by chance?
Yes. She was an 8 and then a 9.
We put these things in.
Put them in your ears and you hear things.
Yeah, and my back.
Okay. And so neonatal period, any jaundice?
Yes,
Okay,
she
that's
did have
jaundice.
jaundice.
Did she have to stay for that? Or did
No, she went home on a wallaby,
Okay.
and she was on that for a week. She got off of it at her 1 week checkup.
Okay.
They said the levels stay the same, but since like they can have a higher level,
Sure.
so it just stayed there.
Okay, she just kind of stayed. Okay. At the very right after she was born, any fever, hemorrhaging, congenital abnormalities? Okay. Any injury with the birth?
No.
Hips or anything? Okay. Excessive weight loss, eating difficulties?
No, she was 5 pounds 7 ounces at 1 week.
So good.
And they said that was in the range, so.
Look
Okay,
at.
and so she came home with you, so that's
Yes.
good.
Look at.
There's
Yeah,
that.
you put them together. That's great. Okay, was she breastfed, bottle fed?
I
was
wanna
breastfed?
do this.
For how long?
22 months.
Great, that's perfect. Okay, and then just general milestones. I got some milestones here. Just kind of wondering how she's doing socially. Showing affection for friends.
I was putting that on
Taking
it.
turns. It's
We're
kind of
working
hard
on
for
that,
3-year-olds. I don't know about that one. Kind of understands what someone else's and what's hers.
Yeah,
That.
she definitely.
Okay. And lots
I'm
of
with
emotions.
this.
Yes.
Okay. For communication, could you follow things with 2 or 3 steps?
Yeah.
I do this with my mom.
And I know she
Yeah.
can say her age and her name, so that's good.
I spell SOPHI.
Oh yeah, so you're way ahead. 'Cause that's not even on the list. Copies of circles. We did see her draw some circles and turn some pages and books.
Yeah, she can.
Okay. Climbs well. I did see her climb earlier too.
Mama, I'm gonna check.
You may check my card.
Okay. Let's see. That looks so good. So developmentally, that looks perfect. She's ahead, I think. Okay. Any major illnesses or injuries?
No.
Easy towards heart. You're so good at that.
You're gonna have to flip it around to me.
Yes.
Let's see. Any allergies to medications?
No.
And you did say seasonally she takes albuterol in the
Yes.
Brown and Zyrtec. What about any medication she takes right now? Anything?
No.
Okay. What about family history?
Sure.
Any major illnesses with mom or dad? Do you?
Her dad has ADHD,
Okay.
and I have allergies as well. But other than that, no.
I have a telephone.
Okay, so
Yeah, you do. Any siblings?
No.
No, I want this.
Okay, it's right here.
Let's see. And okay. She does go to daycare. She stays home.
She goes to daycare full time.
Daycare full time.
I got the telescope.
Perfect.
I need
On
to check your
immunizations?
heart, Mama.
Yes, she should be. She's had all of hers.
Perfect.
And she had a flu shot too.
Any smoking in the house?
Not in the house. Her dad does smoke, but not in the car with her or in the home.
Good. Okay, now we're just going to ask lots of questions about symptoms. These will be a little more
Yeah, that's fine.
based on the body system. So we'll just go through and see if she's having any of these problems, or we can talk about them.
Okay.
Any fever, weight loss, weight gain, abnormal?
No.
No.
Everything's been on
Any
track.
change in activity level lately?
She's really hyper.
Okay, so extra activity.
Yeah.
When did you start noticing that?
It's always been there, but
Okay.
we really notice a difference if she has sugar,
Okay.
and especially things that are like mostly sugar. Like if she has soda or marshmallows, there's a really big change.
Like,
Yeah.
I need some water.
you
Go
need.
get some
Okay, I
water.
was gonna say you need some marshmallows.
Yeah, right.
Water is good. That's great.
Go ask your papa, please.
Okay.
You're asking.
Thank you so much. I'm just gonna ask Mom a few more questions.
You can get some water and then come back, okay?
Her skin. Any rashes, hives?
Not lately. No.
Does she have a history of getting like hives or anything?
No, she did get some really bad rashes from, I don't know, she had a yeast rash once that was really bad, but I know she was hanging on those, so that's just what I think
And
of.
that healed on it. Did you get nice done? Did that heal on
Yes,
its own?
we had nice done. And that worked really well.
And that's not recurring.
No, just one time.
Hair problems. Did you notice their hair, skin texture, color?
She gets like patches of dry, it almost seems like eczema or something.
Okay.
And we put lotion on every day, otherwise they get really big.
Okay, that's good. And hair lotion on her arms?
Yeah, they're right here, and then she'll get them like on her
It
cheek.
was a bug.
There's a bug.
What kind of bug?
Okay, one of your cups.
Okay.
We can look into that. Eyes. Ever had cuts?
No, I don't think so.
Okay. Any foreign body or infection?
No.
Glasses? You were, your dad wear
Close your door.
Yes, her dad does, and I'm supposed to.
Okay.
So both of us.
Frequent colds. I know we talked about allergies.
She only had one ear infection this year, but last year she had 5.
Oh, okay.
So I remember previously we were told if they didn't like decrease that we were gonna look into it, but then she only had 1
Oh,
this
that's
year.
good. Okay.
So she did. It seemed like every time she got sick, she would get ear
She would just
infections.
get it,
Yeah,
sits
like
in
doubles
there.
or singles. She had 2
Yeah.
doubles and 1 single last year.
Oh. Yeah, I
Okay,
know
keep
for
this
2
way.
and under,
This
they
was the
get
puppy cup.
a lot because they're worried about their speech.
Mhm.
Because we're worried about their speech. But then, so if they're slowing down and she's speaking well,
Mhm.
then they're just more common with that
Okay.
respiratory infections.
Well, this is- She also used to have a pacifier until this year.
So if they're having problems and they're sucking a lot,
Mm-hmm.
then not like they get a lot of pain there too. Sneezy, stuffy nose.
Please come sit.
Do you want to sit? Come here. I see you got some
Just
water.
with the
That's a good
allergies.
choice. Just the allergies.
What do you have? What
Um,
else do you have, Allison?
Here, let's put this right here.
This is my only fun thing today. And this pen, which you can borrow in a second.
Just stay here and listen for a minute.
Let's talk about you. Any, did you guys hear?
I need to do
No, she seems.
Thank you. Or do you want to draw us another picture?
Yeah.
Why don't you draw a picture of
Dinosaur.
no kangaroo.
A kangaroo.
Okay.
That's a great idea. Okay.
Okay, draw it.
Mouth breathing?
No, I need
No.
No. Any
I
snoring?
ready.
No, not much.
Okay.
I
Let's
need
see.
to clean the kitty.
When did she start erupting?
4 months. She had 2. Bottom months.
And no problems with that?
No. She's had all her teeth since like she was.
Has she seen a dentist yet?
Yes, she's seen one every 6 months since she was 1.
Oh.
And she just went in January. And everything looks great.
Great. Okay. Anything, no shortness of breath?
Not unless she's having being
With
sick
that,
already.
I know
Then
you're
she
set up
does.
the albuterol. So when she gets the upper respiratory, she does.
Yeah, because
Present
that
with
usually
that.
helps right away.
So she's having some RAD stuff. It sounds like. Color changing with when eating. Problems, chest pain.
No.
Did she ever have a murmur?
No.
Okay. No fainting or anything
No.
like that. Okay.
That would be scary.
That would be scary. It would. Okay, we talked about shortness of breath and some of the triggers. So the lungs are good. No chronic cough. No cough that's continuing.
No, in the
Unless
spring
it's
it'll be
spring.
like for 2 months
Okay.
pretty much, but then she
Definitely
seems
seasonal.
fine. And it'll fade out.
Pattern there. And then she gets wheezing with that too, I guess.
Mhm.
Shortness of breath. Okay. Any history of anemia?
No, no, hers were always fine.
Good. No blood transfusion.
No.
And with that, any surgeries?
No, she's never had anything. Whoa, careful.
Ooh, let's see that. Whoa.
That's really
I
nice.
really like it.
Where's its baby?
Yeah, I need a baby.
Where's the baby kangaroo?
That's it.
Oh, okay.
Are you gonna put a bow on it like everything?
Yeah,
Oh.
but it's bow.
Great. Any for her stomach? Any nausea or vomiting?
She had the stomach flu last year
Okay.
in the spring, and then she had it again this year 2 times.
Okay.
They were like a week apart.
Okay.
That's weird.
No complications from that.
Constipation, not regularly. Not any more than a normal kid.
Okay.
And not
I
anytime
love
taking
Taking anything.
Yeah.
Either. Okay. Stool habits. I mean, how much does she eat? What's her normal?
Once or twice a day.
And she's completely potty trained
Yes.
now? That's awesome.
And she wears panties at night too.
Great. That's nice. Okay. Her diet. Let's see. Foods. Any food she just loves. Any food she hates.
She's actually a really good eater.
Okay.
She'll pretty much eat anything. I mean, she's picky on the day of what she wants.
Okay.
But she virtually likes everything.
Okay.
Yeah. And she really likes vegetables a
Good.
lot, actually.
She has a good
And fruit.
appetite. She's eating her meals and stuff.
She does like to snack more than eat like real
Right.
sit-down meals. But she eats really healthy.
Behavior, that's normal in that age. Food allergies? Anything?
We were told when she was younger that she was allergic to milk, but she drinks milk and we haven't really seen anything. So I don't know if she outgrew it or she had like some lactose issues when she was really little, but by about 15, 16 months she was okay on
Seemed to have resolved.
Yeah.
So for the last year and a half, she's been taking that fine.
Mhm.
Okay. Sweet. So she's snacking about 3 meals a day usually.
Probably more like 5.
More like 5. Good. And let's see, vitamin
Is that okay?
supplements. That's fine. Okay. Does she take any vitamins?
No. She's not. She has on and off, but she's not right now.
Okay. Any increase in urine lately? Have you seen her going
No.
more often? Hot or cold intolerance? She
No.
did really hard with the
She's
hot
fine.
or cold. Okay. Growing in a normal, what you would say was a normal rate?
Yeah.
Okay. Any pain with urination?
No.
No, any urgency for her to go?
No more than
Hard to say.
what's
she's
typical, I
waiting
think.
and
Yeah.
stuff.
She definitely knows how to hold it.
Okay.
So.
Okay, just gotta push
Yeah.
her to go. So it's urgent when she decides to.
Right.
Bone-wise, did she have any fractures?
No.
Any trauma?
She did hit her head on the tile when she was almost 2, and they did a CT scan at the hospital, but everything was normal.
And she didn't have any problems with that the next day?
Well, she was vomiting is why we took her to the emergency room. Yeah, but it turned out she had the stomach flu, and it was the pediatrician said if she started having diarrhea, we would know it was based off of stomach bug that happened to coincide. So that happened. But right after she hit her head, she had thrown up, and that's why we were really worried.
Yeah, that's scary.
But then she was sick for about 4 or 5 days with diarrhea and throwing up. And a fever.
You're a silly girl. You're a silly girl. Great. Any limitations to her functioning? Have you noticed there's things that she just can't do or won't do? Hand, arms she won't use? Things she
Can't
just
sit still.
Oh,
Okay, it's a nice, good coffee like that.
We did talk about the head trauma, so that's we're gonna go under neurological. But any headaches?
Not that we can tell. No, she's never complained.
Did she lose consciousness with that head tie?
No, she did not.
Any seizure activity?
You don't to use it.
Why?
They need it.
Any
Because
behavior-wise?
stuff
Do
on
you
it.
need for any?
She goes through ups and downs of seeming like separation anxiety issues, but right now she's been good. We do have a lot of trouble at night though with her staying in her own room
Hello, Mama.
and wanting someone
Here
to stay
I
with
am.
How long has that been
Hello.
going on?
her. Just since she was 2 and a
Here
half.
I
She
am.
slept,
Here I
we
am.
did sleep training and stuff around 8 months, and she slept by herself.
Hello.
And when we moved, she started wanting someone to be with her, and we haven't been able to get back. Yeah. It's almost a year now.
Any fussy, like
Mama has
fussiness,
the golden
decreased energy level?
Thank you.
No,
No decrease in energy.
excess energy.
Yeah. Sometimes we take her just to wear her out.
Here you go.
Oh, thank you.
It's a money.
Well, was there anything else you wanted to talk about? I think I got a good general basis, and we can move on to the physical exam next. But okay, is there anything that you were wanting to talk about? I know.
No, not really at this time. She's pretty much doing really well.
Good. She does. She seems like she's doing well. Everything's right on. I mean, we do have the allergy. We're gonna keep an eye on that. No history of asthma in the family.
Here, Allison.
No, not really. I think my dad had asthma as
Here.
when he was younger. He hasn't really had any symptoms or anything as an adult. My sister did have exercise-induced asthma as a kid as well.
So could just be allergies. We'll just keep an eye on that, and then the physical exam should help us a little bit.
Okay.
And with her excess energy, I mean, she's 3, so it's
Yeah, it's hard at this
kind
point.
of hard to say. But this looks great. So thank you for your
No problem. It was nice to meet you.
Nice to meet you. Thanks.